So a spinal cord stimulator is a device that interferes with the electrical portion of the pain signal. So if you look at nerves and how they operate, when one nerve talks to another nerve, it's a chemical signal, which is where a lot of medications work to treat pain. But as the pain signal is traveling along the nerve, it's an electrical signal. So we can take advantage of a spinal cord stimulator to interfere with that electrical pain signal in order to relieve pain. The spinal cord stimulator procedure involves two separate steps. The first is to do a spinal cord stimulator trial, where an epidural lead is placed. It's really similar to the epidural that women get who are going through labor and delivery. It's just a small, flexible plastic tube that's inserted into the epidural space in the back, and the box is worn externally in order to dampen the pain signals in the spine as they're traveling up the spine. If that is successful and if it does provide a significant amount of pain relief, we'll take those leads out after a week. Then later, after everything's healed, we go back in and we place a new set of leads in the back with a small battery pack about the size of a pacemaker or about the size of a silver dollar. And that battery pack is just implanted under the skin, connected to those leads, and that runs the spinal cord stimulator. They're rechargeable. Now, most of the spinal cord stimulator batteries are lasting about 10 years. Does the spinal cord stimulator procedure hurt? The spinal cord stimulator procedure isn't terribly painful. Generally speaking, the procedure itself is done with an anesthesiologist providing IV sedation. So there is a small amount of discomfort from the leads afterwards, but it is not generally too painful to have it done. The actual surgical part of the procedure lasts about an hour. Most people can plan to spend about 3 hours at the surgical center from the time they arrive until the time that they're heading home. The spinal cord stimulators can provide relief indefinitely. As long as they stay charged and stay active, they'll provide relief. Best thing to do to know if you qualify for a spinal cord stimulator is to discuss it with your physician. They'll talk about your pain history, where your pain's located, and what types of medications you've taken, what types of procedures you've tried to prevent your pain. One of my favorite things about the spinal cord stimulator is how durable the relief is. Generally speaking, if you take a pain pill, you get pain relief for a few hours. Plus you have side effects from the pain medication. Down the road, you can have hypersensitivity to pain from taking opioids. The spinal cord stimulator doesn't have any of those negative side effects. It's just electrical energy. It can interfere with the pain indefinitely. The only downside to a spinal cord stimulator is that the battery pack has to be replaced about every 10 years. Aside from that, there really aren't any other significant downsides compared to a lot of the other medical treatments available. For me, it's one of those things where I can do it once and then people have long-lasting pain relief for years, where most of the other treatments that we have last anywhere from hours to months. So I like the durability, the relief, and how long it lasts.